Hey Floxies, welcome back to the station. I want to welcome you, and as you know, is where there's help, there's hope. And today what I'm going to do is I'm just going to I just want to give you a complete idea of what it looks like to get someone better and connect the dots for you. Because one of the things I feel out there is is Dr. Hugh legitimate? Does he get people better? How actually does he work with someone to get Floxies better? And in today's video, I want to give you a complete, full understanding of exactly what that looks like. Now, I also want to do this down below in this link. A couple things I want you to do is, one, give me a like. Two, share the video, okay? And then the third thing is, there's going to be a link down in this video that I'm going to give you an opportunity to get 100% of my content for free. Now, what does this look like here? Let me just go through this. So down here, this is like my online Floxed University. So what I mean by that is when patients come to me and they work with me one-on-one, this is content that I've created that I spent thousands and thousands of hours creating. And what I do for my Floxies is I'll say, okay, what I want you to do here, Randy, we're going to be talking about Randy's case today, is I need you to look at module number 3B. And I need you to do this, and study this material and apply that. So in this course right here, within my Doc Hugh University, this is very, very specifically geared towards someone's needs. In order for you to get better, you need to have an independent, an individualized, custom, tailored program that fits your needs, that connects the dots. This is where my skill set is coming. I can connect the dots. I can look at your case, I can look at cases, and I can say, okay, A, B, C, D, this is what needs to be done for you to get better. So all you need to do is click that link, go in there, put in your email, and you create a simple password, and then you can have access to content. Then you can see for yourself what it actually takes to get someone better and to get you well. So let's start with this case. Now, I'll be honest with you, this is probably going to be a longer video because I'm going to go over a case from start to finish. I mean, he's in the process. I'm going to actually be doing a video success story on him here actually next week. But I want to give you an idea of what it looks like to get better. And at the end of the day, it's not about the magic supplement. It's not about the magic diet. It's not about the magic test. What is it? It's about a combination of looking at you from a polytherapy approach. Polytherapy is critical. There's not one thing that's going to get you better. There's not three things that are going to get you better. Maybe it's 10 simple little things that are going to get you better, that start moving the needle from Floxed to healing. And in the video, what I want to do is kind of really give you some kind of sense of what that looks like. Because I feel out in the Floxed community on all the different Facebook groups, there's, oh, I took this, and this helped, and that didn't help. But there's no congruent, here's the full message of what's actually happening. And this is where I feel like I've really refined my skill set to help you and help the community go through this and connect the dots. And I hope today's video is going to help you do that as well. So this is Randy. He's 40 years old. I'm not going to go through all this stuff. I'm going to go over the highlights. So he has tendon pain, foot pain, brain fog, and insomnia. Now, one of the things is this is an in-depth intake that I have people fill out because we need to know. I mean, do you have a small intestine problem? See all this thing in red. Do you have a gallbladder problem, right? So all these things here, starting off with all the correct paperwork and figure out what organ systems aren't affecting, can kind of lead you and steer me to the direction of what seems to be happening with your case and how you can actually start to recover. So the first thing I have everyone do is fill out the paperwork. And this is just really, really important because it kind of gives me an idea, a cornerstone of what's happening with someone's case. Now you can see here, this has 167. That's the score. I like to see this 50 or less. So, there's a lot of things happening. Okay. So then you fill this paperwork out and then we do a discovery call. And obviously this is my actual handwritten notes. I've gotten rid of all his names. So you're not going to be able to understand these chicken scratches, but the good news is I can. So I'll just kind of summarize what actually happened here is he had multiple concussions. He went to a bunch of medical doctors post-concussion. He was floxed. He had sinus infections, and then they gave him the Cipro, and of course he had started having seizures, went in the hospital, and one thing leads into the next. You go in the hospital, you got seizures, and then all of a sudden you have all these major problems that are happening because of this. He's been bouncing around doctor to doctor to doctor. I mean, this is really, really, I mean, everyone that comes to me has been bouncing around a doctor to doctor to doctor. And a lot of people that actually even come to me have actually been to some functional medicine doctors, but they haven't done the complete comprehensive program with the education. This is where I'm really big on. If you've seen any of my videos or anything like that, I try and educate as much as possible. For example, right here, if this is the first time that you're watching it, this is my YouTube station. You just go to Doc Hugh right here. I mean, you're watching it on YouTube, but you know, you can go here, Google me, and this is like some of the videos that I've created here. I have like over 180 videos on YouTube, and all these things are little gems of what I found clinically to help you recover and get better. Now, when it comes to like actually finding your path, this is where the guidance comes in. This is where the expertise comes in, is the path that you need to follow to start to recover. People will come to me and say, I've watched all your videos and like, I know that you can help. I just don't understand the path. This is really where I'm clinically really good at, is discovering the path. Okay, so basically he's completely wiped out at 3 p.m. I just got off the phone with him. He says he can stay up till, he can start working at like until 10 p.m. His brain is completely different. He's just tired of going to the conventional system. His wife, you know, a lot of people that have been floxed, his wife has been, you know, there by his side the whole time. He has brain inflammation. He feels like he has brain inflammation. He has fatty liver. He has a gallbladder problem. I mean, this guy has a lot of things going on, but he has a lot of things happening. So he's a very complex case that's starting to happen. He's in a different varieties of protocols. His tendons are killing him. His feet are killing him. Just to let you know, his brain is 80 to 90% better. So his brain function is 80 to 90% better, and also his tendon pain is down by 50%. Now, this is only after roughly maybe about 10 weeks of actually working together. His mental health, he says he's a hot mess. Right? He just screams like his mental health, when he described it to me, he said, you know what, I'm a hot mess. I can't think, I can't function. I want to take a nap at 3 p.m. I mean, this is all the stuff that was happening to him. And he had tons and tons of doctors, tons and tons of medical doctors out there, and none of them were able to really connect the dots. All right, so let's go on to the next thing. So he came aboard for care, and then when you come aboard for care, what we start to do is we're going to start to do labs. So I'm just going to kind of go over some labs here. And again, my point in here is just to make sure you understand what it looks like for a comprehensive plan. Now, again, if you want the content, just click that link below and you can have my library. All right, I want you to have it so you have some education to get better. So we went through some labs. Now, what I'm really going to show you is the lab is very, very extensive in here. So you can see this right here. This is a blood lab. So anything that's in clear here, that's where normal, healthy lab should be. All right. And then anything that's in yellow, that would be like a string that would be out of sync. The way I describe labs would be, you're like a piano. So if you're a piano has 83 strings. You have 10 strings that are, let's say, out of sync. That would be the yellow markers. And then you have, let's say, 3 strings that are broken. Those would be the red markers. And then you have, let's say, you have 5 pink, which are alarm states. So you want to look at the labs as harmony. Like, have you done this in harmony? Have you got a complete picture so you know what's going on? So I'm not going to spend time going through all this, but you can see this guy is lit up. Randy's lit up. He has 15 yellows, okay? Strings are out of sync. He has 10 strings that are broken, 9 and then 1, 10. And then he has 5 and 2. He has 6 alarm states. So some of the biggest things that he has, he's majorly pre-diabetic. Now, guess what? He's been seeing a doctor for his diabetes, and they've never even mentioned, or not diabetes, his blood sugar, and they've never even mentioned this. They never even did this fasting insulin test that we do. That was never even looked at, okay? He has a bunch of liver stuff happening. These are liver markers, tissue markers. This is a gallbladder marker. So he has a lot of functional things wrong. Here, his ferritin, if you've seen any of my videos, is 704. He actually has a liver doctor, right? Because his liver he's been fatty liver. He has a liver doctor. Guess how many of his doctors have done a ferritin? Exactly 0. None of them have done a ferritin. A ferritin level of 700 is going to totally mess up your liver. Now here, I also have videos on this right here, high ferritin level. So right here, here's a case on ferritin, and here's a case on ferritin. So these are all videos and content that I've created already so people can understand and get these concepts. This is a cholesterol panel. That's all not well. So when you look at this, he's inflamed. I mean, he just has tons and tons of things going on. So what does the blood work really do? You can look at this and you can say, wow, right? Like, wow, no one's actually ever done any comprehensive blood work on me like that. So now I have a whole bunch of different clinical tools that I can figure out what's happening. Well, this is a huge gate for Randy getting better. Like, when you look at this, what's your brain worth? Like, what's human suffering worth, right? I mean, my dad died at 69 years old. He was on 16 medications. I love my dad, but he didn't want to do anything else. Floxy's come to me, and you've done everything. You've been to the system, but no one's really connected the dots. Okay, so that's the blood work. And then we did some additional testing. As you know, if you've watched any of my videos, I do mold testing. So this is a mold test right here. Now, did he have mold? Yes, he had mold. Now, it's not like really huge. The mold is definitely there. Okay, let me say the mold is there, but I've seen markers that are tremendously worse than that. Okay, so his mold here is 20 and this is 7. So does he have some mold? Yep, his mold is probably coming from food because it's so low versus building, or like if you're exposed to mold all day long, you're going to know that these labs, this lab would be something like 2,000, right? So instead of being 20, it would be like 1,500, 2,000, 3,000, 5,000. I've even seen of 6,000. Mold of 6,000. I have some videos on that as well. Then at the same time, so the two tests are the mold test, which is a urine test, and then what I call the organic acid test, which is Great Plains. Now, as of this recording, this is what I'm doing for my workups. Now, my workups even 1 year ago are completely different than what I'm doing right now. Because as I work clinically with someone and trial and error, right? Trial and error, I change my protocols to refine and what I think is to be the most effective, what I find the most effective protocols to get people better. Now, this is also quite interesting in here. So this is the morning void. So in here, this is number 7. This is arabinose, which is yeast. So he actually has some yeast. Now, it's not lab high, but it's there. It's there, okay? Now, one of the things with yeast is you can see this is candida, which is yeast right there. Okay, you can see that. Or candida right in here. Now, candida can produce oxalates. All right, so now if you've looked at any of my stuff here, let me go back to my course, and here I have a breakthrough connection on high iron and oxalates. So what are oxalates? So oxalates are little crystals that can form in your tissues. Now, in my opinion, this is a huge breakthrough. So these oxalates are small little like pieces of shard glass that can form in your tendons. They can form in your nerves, they can form in your muscles, they can form in any tissue in your entire body, and then they can cause that tissue to malfunction and not work properly. So oxalates is very, very critical. And clinically, what I've seen now is a lot of Floxies, guess what, have high oxalates. So oxalates, in my opinion, needs to be ruled out. Now, he had high oxalates and he had high ferritin, which is iron. So you have high oxalates, and then you have high iron. So you can actually form iron oxalate crystals in your tissues, in your brain, in your nervous system, in your entire body. This can be formed as these oxalates. So we really need to handle that. Now, one of the things with oxalates is yeast, candida, okay, which he has, can produce oxalates. So if you have candida, right, and the byproduct is oxalates right here, I'm showing you this right here. And then on top of that, if you have high iron, this is going to affect the basically iron oxalates. And here you can see oxalates right here. Should be less than 67, and he's at 154. All right. So this is a really, really powerful test right there. Then we also did food sensitivity testing, and you can see here he is sensitive to a lot of these different foods. This is a little prick of your finger. So what does the food sensitivity testing say or tell me? It means that you have leaky gut. So you have sensitive to food. So what I mean by that is you have a low-grade chronic mild inflammation. So if you have low-grade chronic mild inflammation, that's going to affect your whole entire body. That's going to affect your brain, your central nervous system, your tissues, everything in your body is not going to be functioning optimally when you're sensitive to foods. And if you're eating these 3-4 times a day, that just causes more global inflammation. Okay, so then here, so this is kind of like the program that we set them up on, the organic test. And again, really, it's not about like what supplement. It's not about, you know, Randy's program. What it really comes down to is when patients come to me, it's about putting the dots together, looking at this piece and this piece and this piece, and figuring the puzzles of the piece out, and then moving forward from that. So I give some direction, like there's some actual clinical direction on what we need to do to get you better and restore function in your entire body. So that's what this is right here. So this is his treatment plan. He had brain fog. So what do you want to do if you have brain fog? You should probably get some computer glasses, right? Some of these computer glasses are easier on your eyes. So for example, right here, I don't actually have a prescription. These are actually glasses that I need just for the computer because he has brain fog happening, right? So then I showed him very specifically what do I want you to watch in the course right here. So this is all the material in the course. I mean, there's got to be a few hundred hours of content here. So I can't have people, if people want to take the time out of getting better, I can't say, go on my course, here's 100 hours. I say very specifically, this is what I want you to watch, A, B, C, and D, and apply that. So I'm taking the time out of you getting better. So when we look at his treatment plan here, these are very specific things that I wanted him to watch and apply. And now since then I have more content on there. This is basically the protocol we set him up on, the Magic Trio, straightforward right there. I wanted him to watch the neural inflammation part right here. So we got on that. And then these are some other supplements that I recommended here. Vitamin D. He's going to be starting to give blood to the Red Cross, starting him on DHEA, which is a hormone, because that was late. And then I want to look at his diet, and you can see here that he's pretty much, you know, he just says unhealthy, shitty diet that he says right here. So we cleaned up his diet a lot. We got him out of a state of chronic sugar. So that might be a case for you. That might not be a case for you. Maybe you have, I don't know, maybe you have some kind of like severe yeast or candida or bacterial overgrowth that needs to be addressed. It's all individualized, custom tailored. So we looked at his meal plan. Like, what are you eating? What are you doing? I need to know all this stuff right here, right? And then these are the calls. We've had multiple calls on him. So, you know, he's rocking and rolling. He's doing quite well. So then recently, okay, so we just had a call with him. Basically, he's doing much better. His brain is 80 to 90% better. His pain, his foot pain, his neuropathy pain is tremendously better. I mean, it's all like he's all really doing quite well with everything here. He's not tired. I can work through the entire day. So I mean, it's all good. He's sleeping like a baby. So really, what happened with Randy? Randy just got better. All right, so you can see all the different moving parts that need to be done in order for someone to get better. If it was as simple as, hey, let's get on the phone for 20 minutes and take this supplement, I mean, everyone would be better. It's not that way. So at the end, the Floxed community needs help. Like this protocol here, these things that I put together should really show you what it actually takes to get someone better, how much clinical thought process is in there, and what it actually takes to recover someone from sickness to health to vitality, and it can be done. God put the most amazing healing power in our body, right? That's what I tell people. The most amazing healing power is in your body. So what we need to figure out is, why isn't that healing power that God put in your body healing your body? So if we can figure that out and we can give the body what it needs to recover, there is possibility, there is hope that you can recover. So thank you for watching this video. Please subscribe to my station. Take advantage of the content on there. My Hugh University. You can have all that content. And where there's help, there's hope. Take care. Bye-bye.